It is another edition of the Road to Recovery with our friends from the Orthopedic and Spine Centers up in Wisconsin. Joining me today is Dr. JJ Prosser. He is an expert in sports medicine and ACLs, and with everything going on up in Titletown, ACLs seem to be the hot button topic. So, Dr. Prosser, appreciate you taking the time. How are you?
Really good. How are you?
I'm doing okay. My football teams could be better, so that probably dictates my mood more than it probably should. But nonetheless, Dr. Prosser, we were talking a little bit off the recording, and you mentioned you used to be a professional athlete. You had an ACL injury. Now you're an expert in ACLs. So I'm excited to lean on your expertise a little bit. But why we're doing the call today is because of the Packers left tackle David Bakhtiari tore his ACL about 2 years ago, almost 2 years ago, and has just continually dealt with different issues, different scopes. He's had multiple surgeries or operations now. So before we dive into the minutia of all that, I'm curious from your perspective, can you define an ACL and maybe how an injury occurs to an ACL?
Sure. So ACL, the term stands for anterior cruciate ligament. Cruciate is a word that means cross. So it's one of the two ligaments in the center of your knee. And the job of the ACL is to prevent the knee from giving out when you're cutting and pivoting.
And when an injury occurs, is the recovery does that always include surgery?
No, not at all. So first of all, with ACL injuries, you can have partial or complete injuries. Partial injuries sometimes do okay on their own. And then with the complete injuries, if I have a senior in high school that tears his ACL, like for football, and he's never going to play again, we can actually brace it to get him through the season. The other caveat is there are people that tear their ACL, and even though it's torn, they do not get instability. They're still able to function at a high level. Hines Ward would be an example of that. So really, it's considered an instability issue. So even though we get an MRI to see it, really making our surgical choice is more based on their exam.
Very interesting. See, I didn't know that. So this is why we rely on experts like you, Dr. Prosser. So on that note, recovery time, it seems to vary, but typically somewhere between 6 and 10 months is my understanding. Is that about right?
Yes, but it's a little more complicated than that. But yes, I would say.
Okay.
Can I go into that a little bit?
Please. Yeah, please.
Okay, so ACL recovery prior to Adrian Peterson, it was a year. But then on 9/9 of 12, when he had his ACL reconstruction, he made it back in 6 months, and he had arguably the greatest season a running back has ever had. So whereas we used to say a year because of him, we all started pushing this 6-month time frame. However, studies show that the graft we put in isn't even strong enough to withstand the normal forces until about 9 to 12 months. So I think in general, 9 to 12 months would be the general range. But I think because of Adrian Peterson, a lot of people would kind of push that timeline and say a little sooner.
I'm glad you brought up Adrian Peterson because it seems like we have, 10 years ago that was about when he tore his ACL, came back and had one of the greatest seasons of all time. It seems like maybe our mind has changed, right? Like you can come back stronger from an ACL injury. That's not always the case, but can that be the case more commonly now? You can come back stronger after an ACL repair?
No, no, you're never the same. When people have these ACL reconstructions, and let's say a year from the surgery, if we're trying to get them back, we have all of these functional testing protocols we can do, and 90% is the number. If they can get back to 90% of what they were, then we clear them. But I can tell you in my hands, and I do hundreds a year, and most of the ACLs I do are people that had the surgery and it failed. I've never gotten anyone back to 100%.
Interesting. So that caught my ear. a lot of them you do are ACL surgeries that failed. How common is that?
Yeah, so yes. So I'll just throw some statistics at you. First of all, last year, the most recent numbers we do in the NFL, out of all the players that have an ACL reconstruction, only 63% of them make it back.
Wow.
It's worse than that. That 63% that make it back, they define that as they make it back for a single game. Now, even though people can make it back in a year from an ACL, they don't reach their pre-injury level until about 2 years. So I can get them back at a year, but actually it's 2 years until they're really functioning. So now if you look at all the NFL players that had ACL reconstruction that got back to their pre-injury level, that number is 43%.
Wow.
So if we define success after ACL reconstruction in the NFL as return to their prior level of activity, that number is 27%.
Wow.
So all the conferences and lectures I go to and do behind closed doors, we honestly feel like we're not as good as we think. And that's hard to take, but it's the truth.
So the debate on turf, Dr. Prosser, is certainly a hot button one. I'm curious on your insight into turf versus natural grass and that big debate that's especially in the NFL has been going on.
Well, so that's a very good question. So there have been multiple studies, both at the collegiate and high school level, and there are multiple ongoing studies. But some of these studies are showing an increased rate of ACL tears on turf, anywhere from 33 to 50%, as opposed to natural grass.
The statistics clearly shows me you know your stuff. So you mentioned to me, you just gave a keynote speech, and all of these statistics, like this has to be concerning for somebody in your position.
I don't know how to answer that. It gives me a job to do. It's
Right.
concerning. I have one high school and two college athlete children. It's concerning. A lot of friends and family. I'm the team doc for multiple high schools and colleges. It's concerning for them.
Right.
Extreme, and the parents. It's extremely concerning.
Right. I guess I didn't mean it from a professional standpoint, but obviously from an athlete perspective,
Yes.
right? I mean, and obviously I know with your background you can relate to that. So it is fascinating to me, and that they are happening more often now than they used to. I guess I'm trying to crack the code, and I don't know if I'm the guy to do it, or crack the code as to why that is.
Oh, so you want to know why there's more ACL tears on turf?
Yeah, I would love to know.
Okay, so the ACL, sort of the most common injury, they'll always say it's a non-contact injury where the foot is planted and the body sort of twists or turns. So on grass, when your cleat is in the grass and your foot is planted and you're twisting or turning, there's give. So that cleat can turn a little bit. Sometimes you'll even kick up mud, it'll come out. It will no longer be planted. On turf, the grip between the cleat or shoe and the turf is so much stronger, there's no give. So the stresses on turf and the resistance are far greater than grass.
So the debate, and I guess when you look at a guy like David Bakhtiari, who's been very outspoken about turf, you would tend to agree it is probably not good for sports. In that regards to injuries.
I would agree wholeheartedly that the incidence of ACL tears are definitely higher on turf.
Looking at, and I always say this, I don't want you to diagnose somebody you haven't seen, right? With David Bakhtiari, though, it's a really interesting case because I mentioned the surgery was almost 2 years ago, not quite 2 years, but almost 2 years ago. And when you say get back to their level, when he's out there, he plays at an all-pro top level. But that's been the issue, right? Getting out there, and it seems to be when he plays and he goes through the strenuous activity of playing left tackle, something pops up and it requires either a scope or another operation and further time off. How common is that, right? I mean, getting back out there, playing so well, and then having more issues pop up. I guess that's the part I'm more asking about, right? Like having more issues pop up post surgery and return.
So I can't say they've done that exact study, but I would sort of put multiple surgeries after that initial ACL reconstruction. I would kind of throw it within that kind of 40% failure rate. So I would say, maybe 20% of the time we have to go back in there.
Okay. So it's not super common, is what you're saying, right? 1 in 5 would be about what you're saying.
I'll say it's not super common, but we're seeing it more and more.
Why do you think that is?
Well, I kind of know why it is, meaning, overall the incidence of ACL reconstructions are going up, exponentially. And whereas it used to be people just tore their ACL, now when I see these patients, they've torn their ACL, they've torn their meniscus, they've torn their MCL, maybe they broke off a piece of cartilage. The injuries are much more complex, and the surgery is much more complex than it used to be. So in turn, there's a much greater chance of having to do additional things down the road.
Lots of great information on the ACL as well. What does it take? Last one for you. What does it take for you to sit somebody down and say, hey, probably shouldn't be doing whatever caused this anymore?
Meaning,
if you're seeing an athlete and they have an ACL tear, and would you ever recommend against going back to competition?
I would never. I think my job is to get them back, to try to get them back as soon as possible, as safe as possible, and to try to get them back as close to as good as they were as possible. I would never say that.
So there would never be a conversation. Hey, maybe it's time to hang it up.
I would never initiate that conversation. Having gone through it, it gives me goosebumps. But if they were to ask me, then I may say, I don't know how much longer we can keep doing this, but I would never initiate that.
Fascinating. Orthospinecenters.com is the website. You can learn more about Dr. J.J. Prosser. If you have an injury yourself, clearly this man knows what the heck he's talking about, and I've really appreciated catching up with him and getting some more info. Dr. J.J. Prosser from the Orthopedic and Spine Centers of Wisconsin. Thanks for your time, my friend. This was great.
Thank you. I appreciate it.